that leads us right into the second cancer. Now you've got metastatic cancer, and now we're into 2022, almost exactly 2 years plus
Right.
like 2 weeks. You're having a second surgery.
Yeah.
So now, after the first surgery, we had talked. You didn't have chemo, so you
Right.
hadn't had chemo. You hadn't had radiology, radiation therapy.
Right. Right.
Now we're getting the second surgery. Walk me through the second surgery.
My recovery, as I said, from the surgery was what you would expect. I'm tired, I'm weak, but I'm recovering. Almost back to where I was before that surgery, but nowhere near where I was before I ever had cancer in the first place. But it was December 27th, 28th, I forget, around that time, but in between Christmas and New Year, I had my first round of chemo. The first round of treatments went exactly like it's, I hate to say supposed to, because there are many elements that are different to everyone who receives chemo, and you can't always predict the responses. But, I felt a little nauseous, under the weather, maybe a touch of diarrhea, but I don't know if anybody who's ever had colon cancer ever goes back to having a normal bowel movement schedule. If so, I don't know of them, but that was a part of it as well. But after a week or so, I started feeling a little better and getting a little stronger, so that by 2 weeks, when it's time for my second round, I felt well enough to get the second treatment. And I get the second round of chemo, and that first week was paralleling my first treatment. Feeling a little under the weather, a little weak, a little nauseous. The problem was, after that first week, I never felt better. There was no recovery. I kind of stabilized there and spent the rest of that week and going into my second round of chemo, with the mild versions of all of the symptoms. And now going in for the third treatment, I just never felt well. The diarrhea hit instantly, the weakness hit instantly, the nausea hit instantly. And by the time I was home and sat in a chair and was useless,